married, but I'm in love with another man who is my church friend. He's also married.
If you're married and you're with another man, definitely you're doing zina. What business do you have to be with another man? And these are some of the social vices that social media is bringing today. So you get involved in chats, and then you start chatting with non-mahrams, and one thing leads to another, and therefore now what happens is now people start committing adultery, doing zina on social media. That is very wrong, and it is zina, and you need to stop it immediately. It's actually bad manners. And as I had pointed out, is we need to use social media responsibly. Now, this is not a responsible way of using social media, where we are involving ourselves with the non-mahrams and chatting with people's husbands and people's wives. That again is very, very bad. So it is at this point that social media now becomes haram.
كالذي نزل الفرقان على عبده ليكون للعالمين نذيرا.
Ni kitabu kitukufu.
Harufu hizi za mkato moja kwa moja
hakuna mfano wake,
na hamwezi nyinyi Makureishi kuwa ni wenye kutunga kitabu kama hiki, ingawa zimetumia harufu zile ambazo zimezitumia katika kuandika au katika kusema.
Miujiza yake Al-Malik.
Mwenyezi Mungu ana uwezo usiokuwa na kifano.
Ni malengo ya Qur'an.
Khazain zote za ardhi na samawati ziko mikononi mwake.
Sheikh Muhammad Badamana na uchambuzi wa Qur'an kwa undani kila Alhamisi saa 3 usiku kwenye Horizon TV. Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Na mtazamaji, shukran sana kwa kuendelea kutegea the Premier Islamic TV station Horizon TV. Unaungana nami Mariam Mwacharo katika Healthy Thursday. Kawaida siku ya leo tunaangazia masuala yako ya afya, na kama tulivyoanza mwezi huu mzima tulikuwa tunaangazia ugonjwa mzima wa saratani. This particular episode we are targeting breast cancer. Nakumbushwa kwamba na producer wangu Shakombo pale kwamba mwezi ndio kwanza umeanza, mimi bado naona niko Oktoba. Kuanzia mwezi wa Oktoba, Shakombo shukran sana, na huu mwezi wa Novemba hapa mwanzo tunazungumzia swala zima la cancer, and today we are targeting breast cancer. And did you know that breast cancer actually affects men as well as women? I know some people, I was talking to them yesterday and they were surprised. Most of my male friends, they were surprised, and colleagues, they were like, oh my God, I did not know that breast cancer can actually affect men. Now with me in studio is Dr. Eric Hungu, who is a surgical oncologist to delve into breast cancer. Karibu sana, Daktari. How are you?
Fine, how are you?
Thank you very much for gracing our show. I am well, thank you. So let's begin with basics. Describe to us breast cancer. What is it?
So breast cancer is when you have abnormal proliferation, abnormal growth of malignant cells, specifically coming from your breast tissue. And that abnormal growth can now give you that lump, which when we test, we can diagnose as breast cancer.
Okay.
So in a nutshell, that's breast cancer. Abnormal cells that come from your normal body cells. And then they undergo some mutations, some changes, then they become cancer.
Okay. And like other cancers, we discussed other cancers in the previous weeks. Are there types of breast cancers?
Yeah, there are some types, what we call subtypes, histological subtypes. And that's why when someone comes to us, we usually have to do what we call a biopsy.
Okay.
So the biopsy means we take a little bit of the tissue, send it to the lab, and then we can tell you what subtype of cancer you have. So usually the common ones are the ductal cancer or the lobular cancer arising from the cells of the ducts or the lobules in the breast.
Okay. And these ducts are there in both men and women?
Yes. So the anatomy of the breast is the same in men and in women.
Okay.
The only difference is at puberty, there is a difference in hormones now.
Okay.
So in the ladies, you get the female reproductive hormones. And that's why you get now what we call menarche. That's when you start getting your periods. That's when the breasts start developing. So in men, that doesn't happen. So the breast tissue remains, we would say, remains dormant.
Okay.
But there's still breast tissue in men.
Okay.
Yeah.
And in these different types of cancers, do they display different symptoms?
No, they usually present pretty much the same way because it can come with a lump. The lump is usually painless. But there's a subtype of breast cancer that we call inflammatory breast cancer, which sometimes can be a bit challenging to diagnose because it might not present with a lump.
Okay.
So the lady might notice that their breast looks red and then the skin looks a bit different, like an orange peel, you know, that dimpling
Okay,
appearance.
yeah.
But when you touch, you don't feel a specific lump, but the skin also feels a bit thicker. So that's the inflammatory breast cancer. But for the most part, most of them usually present with a lump. That's when it's advanced, as in when now it's clinically evident. But there's what we call, when we do screening, you can actually pick up cancer that's not yet presented as a lump.
Yeah.
Yeah.
So yeah, which we spoke on our previous episodes, we were told that once you start feeling the symptoms of cancer, or you see, you know, the symptoms display, it is late. It's already late. Is that true? Is it so? Even for breast cancer?
Yes, most of the time you might find, it might not, I won't exactly say late, but the tumor has been there for some time. Because by the time you can feel a lump, there are quite a few millions of cells in that lump. And that's why we usually advocate for screening before you present with a lump. Because with screening, you can pick up this before it presents to you as a lump. And when you do screening, then that's actually what we call early disease.
Okay.
Yeah.
And what are other symptoms that may be displayed on a patient who has breast cancer?
So the things that we usually tell people to look out for, I know most people will think that we'll present with pain, but most of the time it's painless.
Okay.
Yeah.
Especially breast cancer.
Yes, for breast cancer.
Okay.
It's usually painless. But the most common thing people come to us with is a lump. So they'll say, Doc, I felt this lump and it's been there for a few months. And it's now growing a little bit bigger. So the things you look out for are the lump. You look for skin changes, what now I've described as the orange peel appearance. Some skin changes as well as this. That means the skin turning a little bit red. Sometimes that's there. Sometimes you might notice that your nipple goes back into the breast, what we call nipple retraction.
Okay.
If it's late, sometimes it presents with an ulcer, with a wound. Yeah,
outside?
Kidonda, yeah, on the skin.
Okay.
It ulcerates. Yeah, but that's someone who's had it for some time and they've not been having it looked at.
Okay.
Yeah.
Hizo ndio baadhi ya symptoms ambazo utaweza kuzipata pindi utakapokuwa pengine unashuku ama una breast cancer. And what are the risk factors, daktari, for breast cancer? Okay,
so the risk factors, we usually divide them into two broad groups. They are the environmental factors and then they're the genetic factors.
Okay.
So genetics plays a very strong role in breast cancer. And that's why when someone comes to our clinics, we usually ask them if there is any family history of anyone with breast cancer or ovarian cancer or prostate cancer, because there's a link in the genetics.
Okay.
And by family, the one that we classify them into high risk and average risk populations. So for the high risk, it means if you have someone in your immediate family who has had breast cancer before. So that means maybe like your sister or your mother or your father or your brother. So that puts you at high risk. Or if you've had breast cancer before on the other side. Yeah.
Yeah.
And then That's the genetic. So we are talking about now the genetic mutations, usually the BRCA1 and 2, what people call the BRCA1 and 2 genes. There are some other genes, but the common ones that have usually been focused on are the BRCA1 and 2 genes. And then now there are the other risk factors, like your exposure to estrogen. So that's when the first time you get your period comes into play, and at what point you might get menopause, because the earlier you get your periods, it means you have a longer duration of exposure to estrogen.
Okay,
Because
yes.
estrogen is one of the factors that predispose you to getting breast cancer. So if you get your periods early, if you get menopause late, there is the issue of taking oral contraceptives that contain estrogen. And then now the other things that affect the estrogen, like obesity, because estrogen can be fat, mafuta.
Yeah.
If you're obese, if your BMI is over 30, that's usually one of the risk factors, because that fat can be converted into estrogen by your body. So the bigger you are, the more estrogen you have in your body. So that's another risk factor.
Yeah.
So then that also brings into play the issue of lifestyle.
Yeah.
So you need to maintain an active lifestyle so that you do not get obese and get more risk of getting breast cancer. And then now there's the alcohol intake and all those other things. Something that might be considered protective is if you get pregnant and you breastfeed. So that also has been shown to reduce the incidence of getting breast cancer.
Okay. And what are some of the environmental factors?
So it's usually now those things now. Environmental to mean things that we can modify.
Okay.
So like if you take the estrogen containing contraceptives, if you're not watching your lifestyle, so you're getting obese.
Yeah.
So those are modifiable risk factors. The non-modifiable ones are now your genetics. You can't do anything about that.
Yeah.
Yeah.
And you've mentioned something that's very interesting, you know, beginning, because I was reading when I was doing research, and they said when you begin your menses early, then you're at a higher risk of developing breast cancer. Why is that?
Because if you get your menses at 11 and you get your menses at 16, so you see there's a 5-year difference. So in those 5 years, for the person who gets their menses at 11, there's that 5-year duration of exposure to estrogen. So that increased exposure to estrogen is what increases your risk factors.
Okay.
And also the later menopause, because if you get your menopause at, I don't know, let's say 55, as opposed to someone who gets it at 45, you see again there's an increased duration of exposure to estrogen. Yeah. So the risk factor there is the exposure to the estrogen.
Okay.
Yeah.
So when I was doing research, according to this website, MedicineNet, 1 in 8 women in the United States suffers breast cancer. And what are the statistics looking like here in Kenya?
Locally, I think from the data we get from the Ministry of Health, I think breast cancer is, if not the commonest cancer, then it's a second commonest. It's usually cancer of the cervix and cancer of the breast.
Okay.
It's very common, and even globally, the incidence has been noted to be increasing.
Okay.
And that's why when we talk about cancer, we talk about screening, and we focus more on the cervix and the breast cancer.
Remember, mtazamaji, you can contribute to a discussion on our social media platforms on Facebook, Instagram, and Twitter at Horizontv Kenya. You can send us a live message on our YouTube there if you're watching us from YouTube. I have a question here from one lady from Facebook. She says, I am not Muslim. Okay, I am not married as well, and I have engaged in intercourse several times. Every time I take the contraceptives. Do these expose me to risks of having breast cancer?
I'm guessing she's talking about the emergency contraceptives.
Maybe, yeah.
So usually we check the duration of exposure to the estrogen containing pills. So the 30-day pill and how long you've taken it, because that plays a role. But the emergency contraception really hasn't been shown to have too much effect.
Okay.
Yeah, on breast cancer.
Daktari, if very quickly you can explain to us, to the audience, the stages of breast cancer.
So when someone comes to us and they present to us with a lump or something, some symptoms in the breast, we usually need to sit down with them first and take that complete history and find out if there are any risk factors that might predispose them to getting breast cancer. And then we do the clinical examination, and then now we send for imaging. Well, if we find a lump, we investigate that lump. And then if that lump comes back and shows that it is cancer, then we send for other tests to stage. So when we examine, this is what we call the clinical staging. So we assess the size of the lump. So we usually estimate in centimeters, so that if it's 2 centimeters, 2 to 5 centimeters, or more than 5 centimeters, if there is skin involvement, if there is nipple involvement, or if it's fixed to the chest wall. And then we usually assess the lymph nodes under the arm, in the armpit, because that's usually the first place the cancer cells spread to.
Okay.
So we check if the lymph nodes are big, or if they are all matted together. And then now after that, the next thing we need to do is image the breast first. So that is usually dependent on your age, because there are 2 images we can do. You can either do an ultrasound or you can do a mammogram.
Okay.
So the guidelines and the recommendations are, if you are 40 and below, the best imaging test is an ultrasound.
Okay.
If you're 40 and above, if you're above 40, we do a mammogram. The reason being is below 40, the breast tissue is pretty dense. So if you do a mammogram, on the image it appears white. So if there's a small lesion, you might not be able to tell too much about it. So an ultrasound is more accurate. So we do the imaging, and as we are doing the imaging, we are looking at the lymph nodes in the armpit. So that gives us a T stage and an N stage. T for tumor, N for lymph nodes.
Okay.
And then after that, the imaging will tell us whether this is suspicious for a cancer or not. Whether they see a lump, they'll tell us how big it is, how it looks, and everything. And then now we do what we call a biopsy.
Okay.
So there are usually 2 types of biopsies we can do. There's one that's called a fine needle aspirate, FNA, and there's one we call a core needle biopsy. So the FNA usually use a regular needle and syringe, and you just put it in the lump and you make a few passes and you get a little bit of fluid. You put it on a slide, goes to the lab, they tell us whether they see any malignant cells.
Okay.
That usually, sometimes you don't get some accurate results. So the one we usually rely on is what we call the core biopsy. So the core biopsy, the needle is a little bit bigger. It has a spring-loaded mechanism. We call it a gun, but not to scare anyone. It gets a little bit of tissue, a core of tissue, because it goes into the lump. It fires into the lump and comes out with that core, that strip of tissue. So we take that tissue, it goes to the lab, and then we run those tests. Then that's what tells us which type of cancer it is, whether it's ductal or whether it's lobular.
Okay, let's come back to that as we continue that discussion. Nimeshtuka kidogo pale daktari amesema kwamba kuna sindano nyingine. Okay, it is not painful, but he says it is bigger and it, shoots in the breast tissue. Okay, mtazamaji, tuchukue pumziko letu la kwanza. Tutakaporejea tutaendelea na our discussion on breast cancer. Remember, you can join our discussion on our social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, or on my Facebook, papo hapo Mariam Kasim. Tuma swali lako ama comment, na tutakaporejea line zetu za simu zitakuwa wazi, sende mbali.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
On the next episode
Mwenyezi Mungu atawapatiliza waja wake, waja wabaya atakuja kuadhibu. Kwa hivyo wao wangeona pengine wamefaulu, waona hapa duniani, pengine wakitaadhibiwa duniani wataadhibiwa akhera. Ikiwa mtu ni mbaya, ubaya wake mbele yeye na Mungu, basi Mwenyezi Mungu ataangeleza kumwacha mpaka akhera.
Kuna faida gani twapata tukimjua Mtume sallallahu alaihi wasallam,
nabii mwenye ushawishi mkubwa duniani?
Tukizikwa tukitiwa kaburini, tutaulizwa haya maswali matatu: man rabbuk, ma dinuk, man nabiyuk.
Sheikh Jamaluddin anakupa simulizi.
Huwezi kumpenda mtu usiyemjua
na kutambua sunna zake,
lakini ukimjua na ukimtambua Mtume Muhammad sallallahu alaihi wasallam, mapenzi yako yatazidi.
Ufahamu Rasulullah, familia na maswahaba wake. Tazama sira ya Mtume kila Jumatatu saa 1 jioni kwenye Horizon TV.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
Oh, there was no painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Maria Mwacharo.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakuita wanatambua kama Maria Mwacharo. Unatizama The Sabah Show.
Na mtazamaji, shukran sana kwa kuendelea kutegea kurunzi ya Taifa Horizon TV. Kumbuka unaweza kutupigia simu kupitia nambari zilizoko kwenye skrini yako kwa sasa, ama pia ututumie message kupitia nambari iliyoko kwenye skrini yako, na vile vile pia kuweza kuungana nasi katika social media platforms zetu ama kurasa zetu za mitandao pale katika Facebook, Instagram na Twitter ni @HorizonTV Kenya. Vile vile unaweza kunitumia swali ama comment yako kwenye Facebook yangu @MariamKasim. Ukinitafuta utanipata. Tunazungumzia breast cancer na Daktari Eric Hungu ambaye ni surgical oncologist, right? Yes, Daktari, you were talking about staging. After
yes.
The tissue is taken by the...
Yeah, so we get the tissue, then we can tell you whether it's a ductal carcinoma or whether it's a lobular carcinoma. There are some other tests that can be done on that tissue, what we call the receptors.
Okay.
So that checks the ER, the PR, and the HER2, because it can decide how we can tailor the chemotherapy, but that's usually the oncologist who decides on the chemotherapy that's given. After we've established the diagnosis of cancer, then now we send for other imaging now so that we can stage it properly. So it can either be early stage or late stage. So we usually send for the guidelines for later stage. We do CT scan of the chest and the abdomen. If it's early, that means if the lump feels small, we send for a chest x-ray and an abdominal ultrasound. So the whole point of doing this is to check if the cancer has spread outside the breast. So what we call metastasis.
Yeah.
So we want to check if it's gone to the lungs, if it's gone to the liver, if it's gone to the bones. The bones usually of the spine, because that's the common place where it goes to when it comes to the bones. So when we have all those things now, then we can stage the disease. So to simplify it, we usually now say it's either early stage or it's late stage.
Okay.
And that usually informs us on whether we can, on our aim of treatment, whether we are aiming to achieve a cure or we are aiming to achieve what we call palliation.
Oh yes, palliative care. Okay. There's a question that has come in about there's a lady who's asking, Habiba hapo umeuliza, mimi nikipika chakula kwenye ile non-stick pan yangu kuna vile vitu hutoka ile non-stick inatoka ikiingia kwenye chakula huwa siipati. Je, hii inani expose to breast cancer? And someone else pia ameuliza, many people wanasema nyama choma ikichomeka nyama huwa ikichomeka inako exposed to breast cancer. So I had some time and I spoke to Dr. Sitna about this misconceptions chakula with breast cancer. If my producer Mohamed Shakombo pale anaweza kutuwekea that short video on some of the foods, wengine wanasema microwave and everything, and then Habiba na Swaliha, you can take a look at that. Mohamed Shakombo?
What types of foods, probably, because we have heard a lot in food. I don't know if maybe it's rumors, propaganda, but people say some types of foods do actually cause you to get cancer. Like this morning, I was just reading an article from one newspaper and they talked about microwave popcorn. And you know, these are really like potato chips and stuff like that. What kind of foods can actually, you know, cause cancer?
I don't think that that's been like fully decided, because there have been huge studies that have looked at different types of diets and whether they help or not help. Those studies are very difficult to do, but what at least we know is that if you have a diet that is rich in fruits and vegetables, that seems to reduce the risk of cancer. So there's no food I can say this food causes cancer, but if you're going to eat a lot of chips, you're going to eat a lot of potatoes, you're going to become obese, and we know that obesity is a risk factor for cancer, right? The only thing that I would say is in the previous years, people used to, before the invention of fridge, people used to preserve their foods by putting a lot of salt in it so that it preserves it. So in communities where they have a high salt diet, those increase the risk of food pipe cancer. So there's a Japanese community where they preserve their food in salt, and there's a high risk of esophageal cancer in those areas. The other thing is if you eat a lot of nyama choma, that is associated with colon cancer, because the burnt meat produces some proteins that actually cause inflammation or changes in the colon, and if you do that over a period of time, those normal cells become cancerous cells. So, and we're not talking about if you eat nyama choma once a month. We're talking if you're eating a lot, like very frequently.
How frequently? Like say every weekend, every...
And also quantity, you know that some people will take like 2 kilos, you know, so it's... And then everything about cancer is about exposure. The longer your exposure to certain things, for example, the longer you smoke, the higher your risk. So everything is about the length of exposure. For example, if you work in a place with a lot of pollution, this can increase your risk of lung cancer if you don't have protection. So we know that everything is about the length of exposure.
So even normal people, let's say for example people who aren't actually smoking, because they are exposed to environments where people smoke, they do have a risk of getting
and that's
cancer.
well documented that secondhand cigarette smoke exposure increases the risk. For example, if you have a spouse that smokes and they're smoking in the house, your spouse may not get cancer, but you may get cancer because of that. So secondhand smoke is an important risk factor for cancer, and it's very good that you've pointed that out, and especially for people who have small children in the house. So you're better off smoking outside because you're exposing your children, and your children are growing, so the risk for them is much higher.
So even environmental pollution can actually cause cancer. Say the fumes from
petrol, people who work in petrol stations, the hydrocarbons, people who work in, for example, when they are mining coal or mining cement, like asbestos. So all those are risk factors.
There is a very common belief that plastic can cause cancer. Is that true? Because people say, for example, if I've put water in a plastic bottle and then I put it in my car and then the water stays there, the heat, you know, it hits the bottle, something like that, or canned foods. Is that true?
So I think that the question of plastic is important. we really don't have all the information, but we know that if you put a hot thing in plastic, there are elements of that plastic that get into your food. What is the long-term effect of that? We don't know yet. But I think it would be safe to say that, for example, if you're putting food in a microwave, you need to use plastic that is said to be safe for microwave. You just don't use any container for your microwave, right? Yet we know that there's still no evidence to say that if you cook food in your microwave, that is a risk factor. So, but it's good that you just need to be careful with plastic, you know. When you put it in heat, it changes its composition. For example, if you put hot water in a plastic bottle, you can see the way it changes in shape.
Yes.
So we may not know all the information about it, but it's better to be safe rather than, you know, be sorry later.
True.
Yeah, that was Dr. Sitna pale tukizungumza naye kuhusiana na some misconceptions on food, and Swaliha and Habiba pale, you've asked those questions. I hope you've gotten your answer. For Habiba, I don't know about the non-stick pan. I think it is the same thing, so nitaweza kuuliza hilo swali. However, daktari, once diagnosed with breast cancer, what kind of treatments are you looking at?
So first of all, treatment of breast cancer is not down to one discipline.
Okay.
So we usually have what we call multidisciplinary teams, where you have a surgeon, like a general surgeon or a breast surgeon. We have pathologists who help us make the diagnosis. We have radiologists who help us do the staging. We have the oncologists. Now, oncologists, you can have medical oncologists, you can have radiation oncologists. So they give the chemotherapy and they do the radiotherapy, the radiation therapy. And then in the team, we also have plastic surgeons. So in case we need to do some reconstruction. We have nutritionists, we have physiotherapists. So treatment is surgical and chemotherapy, radiotherapy, hormonal therapy. Those are the 4 options. So we can use all of them in combination or daylight according to what you have presented to us with. So I will talk about the surgical aspect of it because I'm a surgeon. So surgically, there is how we treat the breast and there's how we treat the axilla, the armpit. So for the breast, the options can either be what we call a mastectomy. So mastectomy means you are removing the whole breast, or there's what we call a breast conserving surgery. That's a term now that encompasses all those things that used to be said before: lumpectomies, quadrantectomies, wide local excisions. So we broadly call them breast conserving surgery. Then for the armpit, there is what we call, it can either be axillary dissection, so that means you're removing all the lymph nodes in the armpit, or what we call a sentinel node biopsy, where we just remove some of them, depending on our assessment before we go for surgery. So not everyone is eligible to all these types of treatment. And then now, locally, I know most people, I don't know why they think we don't have the expertise here, and they want to go to India and I don't know, to the US and to, I don't know whether they go to Cuba. But if we do the surgery, we have plastic and reconstructive surgeons who can reconstruct the breast. So it can be reconstructed using implants, those silicone implants, or we can use your own body tissue to reconstruct the breast. And then, so the mainstay of breast cancer treatment is surgery, but it has to be used together with now all these other things. So sometimes the tumor, when you come to us, the tumor is very big. And if we think that we are not able to do surgery and get it all out safely, because we do not want to leave any tumor cells behind, because they will come back. So if it's very big, we can start with chemotherapy just to shrink it, so that now when we come for surgery, we're able to get everything out. If it's not that big and we can do surgery, we start with the surgery, and then afterwards, they can go for the chemotherapy. So whenever we do surgery, whatever we remove, we send to the lab. So in the lab, they will tell us how big the tumor was, how many of those lymph nodes had disease. And that will inform the decision now whether you will get radiotherapy or not.
Okay.
So you see, we've done surgery, we've done chemo, and then depending on those results, we'll give you radiotherapy. And then you remember when we did the biopsy, there were those tests we were doing, the hormone receptors.
Yes.
So if the hormone receptors are positive, then we can continue with hormonal therapy. So that's the tablet that people take for 5 years or 10 years, that's tamoxifen. That's the common one used.
Okay.
Yeah.
Okay. There's a question that has come in here. She says, I have just had a baby and I have stage 1 cancer. Can I still breastfeed my baby?
Breast cancer?
Yes, stage 1 breast cancer.
So ideally, if she's been diagnosed with breast cancer, the first thing we need to do is take care of that cancer. So if she says it's stage 1, then that means our aims of treatment are to achieve cure.
Okay.
So the thing about now that she's just delivered, you can give the baby formula as we take care of your cancer, so that you're able to be there to watch your child grow up and get more babies.
Okay. Yeah. Naona kuna maswali mengi mengine yameweza kuingia. Mtazamaji, unaweza kuendelea kutuma maswali yako kwenye Facebook yangu kama ambavyo mmeshafanya, ama kwenye social media platforms zetu Facebook, Instagram and Twitter at Horizontv Kenya, na vile vile unaweza kutupigia simu papa hapa studioni kupitia nambari zilizoko kwenye screen yako, ama tutumie message pia katika hiyo 21951 iliyoko kwenye screen yako. Tunarejea muda usokuwa mrefu mtazamaji, na kusihi usende mbali.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
That was not painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Na mtazamaji, shukran sana kwa kuendelea kutegea the Premier Islamic TV station Horizon TV. Unaungana nasi katika kitengo chetu cha Lala Salama katika Healthy Thursday. Leo tunazungumzia breast cancer with Dr. Eric Hungu, who is a surgical oncologist. Daktari, kuna maswali yameingia. One lady says, I have implants in my breasts. One of them has ruptured and the fluid is in my body. Does this pose a threat to me in breast cancer?
So, first I'd like to tell her, if the implant has ruptured, she needs to be seen by a plastic surgeon so that that implant can be removed. But it does not increase risk of breast cancer.
Okay.
However, some recent research done in the US says that around that area now where that fluid has leaked, there's a chance of some other type of disease coming along, because it's causing some inflammation. So they were calling it, I think, implant-based lymphoma or something of the sort. So the best thing for her is just to go to hospital, see a plastic and reconstructive surgeon, and we can remove that implant and see if you're going to do anything else about that.
Okay. Kwa hiyo dadangu, go to hospital, get yourself checked. Where the fluid is, you have to have the implant out, as the daktari amesema. Daktari, also someone has say, I have had breast cancer on one of my breasts. Is my other breast at risk of developing breast cancer?
Yeah, so you remember at the beginning we talked about high risk population and average risk population.
Yes.
So if you've had breast cancer on one side, there's a chance that you might get cancer on the other side. It doesn't always happen, but if you've had surgery for breast cancer on one side, we always recommend at least annual follow-up. So that we examine the other side, we image it and screen it, so that in case anything was to happen, we catch it early.
Okay. And on that note, before I take this other question, how many times should one, say me for example, I've never gone to any test or screening for cancer, so how many times should I visit the doctor for screening of breast cancer?
So first of all, I don't know how old you are, I won't ask, but the screening is based on age.
Okay.
And also on which category of the population you fall into, if you're high risk or average risk. So talking about average risk population, we start screening. The guidelines say we will start the regular screening now at 40.
Okay.
So at 40, we do annual clinical examinations. That means a doctor, a breast surgeon preferably, can examine you, and we send you for the screening mammogram from 40. So it's annual from 40 to 55.
Okay.
So below 40, we can't do a mammogram, we can do an ultrasound.
Okay.
So for the average risk population, we say that at least every 2 to 3 years, you get a clinical examination and you do an ultrasound.
Okay.
So above 55, then we do the examinations every 2 years till 75.
Okay, till 75 years.
Yeah.
After 75,
then after 75, we don't need to. But most people just prefer to continue screening.
Okay.
So we can continue doing the screening every 2 years.
Okay.
Yeah. But the important thing is, even as we are doing this screening, each lady has to take responsibility for their own health.
Yes.
And that's why we talk about breast self-awareness and breast self-examination. So that if it's in between the screening times, you're still checking yourself.
Okay.
And if you see anything different or anything new, you come immediately to hospital without having to wait for the next screening appointment.
Yeah, and on that, how do you do the breast examination? And I would like to believe that this is for both men and women.
Yes. So the screening, usually we don't recommend routine screening for men.
Okay.
Because they don't have a lot of tissue. If there's a lump that will happen or if there are any changes, it will be quite evident.
Okay.
It's just that men, usually, we are not very good at taking care of our health. We're usually in denial, so we don't go to hospital.
Yeah.
We just ignore it and hope the problem will go away.
Yeah.
But if you notice anything different as a man, please go to hospital.
Okay.
So the self-breast examination. So how we recommend you do it, you start with what we call inspection.
Okay.
So that means you take off your tops and your bra, you stand in front of a mirror, and you look at yourself in the mirror. You're looking at the skin to see if there are any of those changes we talked about earlier.
Yes.
Any changes in the nipple, if there are any obvious lumps, if there are any skin changes. And then you also want to see the symmetry. Breasts are usually not the same size.
Yeah.
But if there's one that's grossly bigger than the other one, then maybe there's something going on. And then you can put your hands up or down and akimbo just to see if there's good movement of the breasts. And then after that, you lie down on the bed.
Okay.
And put one hand behind your head, and then you examine yourself with the other hand. So the fingers, the flat of the fingers. Yeah.
Okay, that part, this part.
This part. Yeah.
Okay, this part.
Yeah. So then, with one hand behind your head, you go systematically and examine all, we call them quadrants of your breast. So if you're going to go clockwise, make sure you examine all areas clockwise.
Okay.
And you examine the nipple, see if there's any discharge from the nipple, and then you check under your arm to see if there are any enlarged lymph nodes. And then you do the same for the other side.
Okay.
And we say you do this at least once a month.
Once a month. And yes, is it important? Because I know there are changes that usually happen when you're, on ovulation period, on your menses. So what is the best time to do this examination, or any time?
So it's usually round about ovulation and your period. So that peri-menstrual period.
Okay.
Yeah.
Okay. So let's take a look at one of the questions here.
There's another question, yeah?
Yes, there's another question.
Yeah.
I am a breastfeeding mom.
Yeah.
My nipples usually get very dry and even crack to a point it's very painful for me to breastfeed. I use petroleum jelly and coconut oil sometimes. However, they have become very red and I have swellings around my areola with a lumpy feeling, and some look like boils. Could this be breast cancer?
No.
No?
Well, let me not be categorical, but usually in breastfeeding moms, that's usually an infection.
Okay.
So that's not to say that breastfeeding moms can't get breast cancer, but from the way she's described it, again, she will need to be seen by a doctor to be examined and to be sent for tests, but it sounds like it's an infection. So that infection can be that cracked nipple, then bacteria get in, you get what we call mastitis, and then sometimes that mastitis can progress to give you an abscess.
Okay.
So an abscess is a collection of pus. That might be what she's describing as looks like a boil.
Okay.
So she still needs to be seen by a doctor. We probably need to do an ultrasound and see if there is pus. And if there is pus, then we need to get that pus out.
Okay.
What we call incision and drainage in theater. So we remove it, we clean it, and we give antibiotics.
Okay. Another question here that has come in, and I hear that there are some questions that are coming in on our SMS line. There's a lady who says, I am 33 years old. Once I went to a doctor and he said, the later I get to having a baby after 30, I have put myself at risk of developing breast cancer. Is this true? Because I am not even planning on having a child soon. Okay, yeah. So she's 33, she does not have a child. And she went to a doctor, and the doctor told him, or her, sorry, that after 30, if she has not yet had a child, then she's at higher risk of breast cancer. Is that true?
So it all comes back to the whole exposure to estrogen. So when you get pregnant and you breastfeed, during that period, the estrogen levels are not as high during the monthly cycle.
Okay.
So pregnancy and breastfeeding sometimes is considered protective from breast cancer. So that brings in the aspect of infertility. So there's ladies who can't get babies and they have what we might call anovulatory cycles. So that means that they might not be producing estrogen, that's why they're not getting babies. So that does not put them at any increased risk of getting breast cancer.
Okay.
There's also the whole point of what's it called, IVF, in vitro fertilization.
Yeah.
So studies usually they've been showing that there is no increased incidence of getting breast cancer if you've been undergoing IVF, but they're still investigating that angle. The other angle is hormone replacement therapy. That's for the ladies who've gotten to menopause, and then they're getting the symptoms of menopause, the hot flashes and all those mood swings.
Yeah.
So some time back, they used to be given hormone replacement therapy, and that had been shown to increase the chances of you getting breast cancer. So for this lady, either way, she just needs to keep getting screened for breast cancer. Yeah.
Okay. So keep on getting screened for breast cancer. Another question. I was born with very small breasts and therefore decided to have some hormonal injections to enhance my lady features more. Do these injections pose a threat of breast cancer to me?
Well, we need to know what injections she got before we can
I guess maybe they're for an enlargement, I think so. I don't know. But she says hormonal. So we need to know exactly, dadangu pale, okay, Salsabila. Okay, Salsabila, you say that you've been taking hormonal injections. We need to know exactly which hormonal injections they are. So, Daktari, if I may ask now, say for example, a doctor has assessed your family history and determined that you have other factors that put you at risk of breast cancer. What options are there to reduce this risk? Say I've gone for screening, I don't have breast cancer, but in my family, there are people who have had breast cancer. What steps can I take in order to prevent myself from getting breast cancer?
That is a very interesting topic for discussion.
Oh, it's a whole topic?
Yes.
Okay.
Because you remember we said genetics play a very big role in getting breast cancer.
Yes.
There's nothing we can do about our genetics. So for you to reduce your chances of getting breast cancer, this now brings to mind, I don't know if you recall a few years back, Angelina Jolie.
Yes.
She got tested, she was found to have the BRCA1 and 2 genes.
Yes.
Which means that she was a much increased risk of getting breast cancer. So what she opted to do was get a bilateral mastectomy. And she even went further and got her ovaries removed.
Okay.
So as long as you have a genetic risk and as long as you have breast tissue, there isn't much that we can do to reduce the chances of you getting breast cancer. So now that's when the surgical aspect comes into it. So since you do not have breast cancer, we can do what we call now prophylactic. We are trying to get ahead of the problem. So you'll remove the breast tissue, but you can spare the skin and the nipple.
Okay.
And then now you reconstruct using now the implants.
Okay.
Yeah.
Okay. Okay, so Daktari, I do have some questions that are coming in, but some of them are a bit more general on just cancer. Keep on sending your comments. We are unfortunately out of time. Maybe just your parting shots, Daktari.
Parting shots are, we need to take charge of our own health and take responsibility for our own health. So keep checking yourself, keep going for screening, and get insurance. NHIF really helps.
Yeah.
Yeah.
Okay. So thank you very much, Daktari, for gracing our show.
Thank you.
I will have a word with my producer. We see if maybe we can have another program on breast cancer, since so many people are sending questions and cancer in general. Thank you very much to our audience pia for tuning in. Na wale waliweza kuuliza maswali on our social media platforms as well as on my Facebook pale. Thank you very much for tuning in. And to my team, starting from my super producer Mohamed Shakombo na assistant wake pale director Yusuf Farah, Saida Abud, pamoja na our sound guy Muhammad Otreo, and our technical operators Binyamin, Hassan, Sai na Sumeya. Thank you very much. I cannot forget you, Sadiq, social media, and Hamed also. Thank you very much for kunisaidia kuweza kufanikisha kipindi hiki. Kwa sasa kwangu mimi, kutoka kwangu mtazamaji, nasema maasalama. Hapo kesho utaweza kuzungumza naye ama kuungana naye Aisha Khan katika The Round Table wanapozungumza thorny pertinent issues. Mtazamaji, endelea kutegea Horizon TV, tunavyo vipindi murwa kabisa. Shukran sana, ndo meli ishafika hivi, tunaelekea zetu, tunateremka. Kwa sasa maasalam.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakuita wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.